Hoping you won't have a crazy, terrible red Christmas with excess bleeding due to your fibroids. What can you queue up for 2025 to reduce the symptoms and the annoyance that you have of your fibroid tumors? Hi, I'm your local OBGYN. I love women, and let's talk about it. So, fibroids are usually benign tumor growths of the uterine muscle. They can be big, small, they can cause symptoms that are bleeding, infertility, abnormal pregnancies. They can cause pressure, pain, the whole gamut. Some people have no symptoms, but the management of them is getting a little bit more sophisticated. So, number one, if you do have symptoms, you can try something like a hormonal birth control to regulate the bleeding and symptoms. There's also the option of something that actually turns off the hormones called a GnRH agonist, which will basically quiet down the hormonal load to the fibroids, hopefully reducing symptoms. The additional thing is that you can do beyond that are a uterine artery embolization, which basically plugs blood flow to the fibroid so it can't really get fed or grow anymore. There's also an MR ultrasound frequency ablation, where basically there's this fancy ultrasound process that attacks, annihilates, and like burns the fibroid to smithereens so that it'll decrease and kind of like necrose itself away. This is also similar, but with a different machine, as a radio frequency ablation, which again, just with high heat waves, goes into the fibroid and annihilates it that way. That's a real simple way to describe it. A myomectomy is a way to pick the fibroids out. This is useful for somebody who wants to preserve their fertility. The problem is that some people's fibroids make their uterus look like Swiss cheese afterwards, and it can be a really long, bloody procedure to recover from. There's obviously hysterectomies, which are done for this as well. Any of these can be reasonable depending on where you are medically and what your goals for 2025 are.